About half of American adults have high blood pressure, and despite the substantial benefits of exercise, many with this condition may be nervous about exercising, and understandably, because they don't want to do too much and hurt themselves further. This video is going to cover some of the current exercise guidelines for people with high blood pressure. That way you can start moving more confidently. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise can be used as a way to prevent diabetes and many of the complications that oftentimes come along with this condition, like high blood pressure. The content that I'm covering today is going to be based mainly off of the most current guidelines from the American College of Sports Medicine and the American Heart Association as of September 2022. Throughout this video, I'm going to be using the terms systolic and diastolic blood pressure. Whenever looking at a blood pressure reading, systolic refers to the top number, and this is essentially the pressure against the blood vessels whenever the heart contracts or whenever it beats. And the diastolic number, when looking at the blood pressure reading, is going to be the bottom number. And this value represents the pressure exerted against the blood vessel walls whenever the heart is relaxing in between heartbeats. So it makes sense that the diastolic number should be lower than the systolic because we would expect less pressure whenever the heart is in its relaxation phase. High blood pressure is defined as having a systolic blood pressure of at least 130 millimeters of mercury or having a diastolic value of at least 80 millimeters of mercury. Now, high blood pressure is a risk factor for cardiovascular disease. And if you're working with an exercise professional, they may be able to help you determine if you have other risk factors for cardiovascular disease that might indicate if you need to get cleared by a doctor before you start an exercise program. If you're not working with an exercise professional, a cautious approach to take would be to meet with your doctor first. Since it's quite common for people with high blood pressure to have other conditions as well, like diabetes, metabolic syndrome, or renal disease, it's good to meet with your doctor and determine first if you have any other conditions or risk factors. So meet with your doctor, get their recommendations, because they may have specific insight as to tips that you should follow, such as exercising at lighter intensities. When people without high blood pressure exercise, typically the systolic blood pressure increases and the diastolic blood pressure either stays about the same or it decreases a little bit. Now, blood pressure response behaves a little differently in people with high blood pressure. Typically, the systolic increases faster and it can reach much higher levels, and the diastolic actually increases a bit too. Now, it's important if you have high blood pressure to check your blood pressure before you start exercising to make sure that you're not starting an exercise session with blood pressure values that are too high. Make sure that your systolic is under 200 millimeters of mercury and your diastolic is under 110 millimeters of mercury. I'm curious as to how frequently you take your own blood pressure. Please comment down below and let me know how often you take your own readings. Some people with high blood pressure have what's called uncontrolled severe high blood pressure. This means that their systolic value while at rest is at least 180 millimeters of mercury, or their diastolic while at rest is at least 110 millimeters of mercury. Now, the term uncontrolled, this doesn't mean necessarily that the person isn't doing everything within their control to manage their blood pressure. If they can't afford medication or don't have health insurance, I would argue that those circumstances are out of the patient's control. And sometimes it's related to the doctor's decisions as well. If the doctor didn't have enough time during the last office visit to properly assess the patient, or if the doctor's concerned about some of the side effects of blood pressure medication, this could also contribute to uncontrolled severe high blood pressure. Either way, it's important that if you fall into this category, that you only engage in light physical activity until your blood pressure is properly managed through medication. Once you start exercising, during exercise, if your systolic value gets up to at least 250 millimeters of mercury, or your diastolic value gets up to at least 115 millimeters of mercury, stop exercising. The challenge here is that it's typically not very practical to have your blood pressure measured while you're exercising, unless you're working with a trained exercise professional. This is another reason that it's important to have that conversation with your doctor so that they can guide you through exercise recommendations that are safe and right for you. How a person with high blood pressure responds to exercise is highly individualized. While most people with high blood pressure respond well to exercise, there's a small percentage that don't respond at all or have an undesirable effect, especially when we start to consider all the different types of medications that they might be taking. Now, unfortunately, the combined effects of medications and exercise on the blood pressure response are not very well understood. Now, since both muscle strengthening exercise and aerobic exercise are very good at lowering blood pressure right after the exercise session, and blood pressure medications tend to lower blood pressure as well, we want to be mindful of the blood pressure not dropping too low right after the exercise session. This is one of the reasons that the warm-up and the cool-down are especially important for people with high blood pressure, because we want to make sure that we're starting exercise and stopping exercise at a gradual pace. If you're finding this information helpful, please give me the thumbs up and hit the subscribe button. Once you've been cleared for exercise by your doctor, there are a few special considerations to think about when exercising. The first one has to do with what are called isometric exercises. So with these types of exercises, the body isn't actually moving, but the muscles are still contracted or tensed, like during a plank position. Now, the current recommendations by the American College of Sports Medicine are to keep isometric exercise training to a minimum. However, there's little to no evidence that suggests that when isometric exercise training is being done in people with high blood pressure, that it's actually risky. In fact, there was a meta-analysis that was conducted by Smart and colleagues in 2019, and they found that isometric exercise training in people with and without high blood pressure significantly reduced blood pressure without causing any type of risky situations. It's important to note that the exercises that were included in this meta-analysis included hand grip squeeze and leg extension. It would be good to see what happens to blood pressure whenever we're testing exercises that involve larger muscle groups that are more common in fitness settings, like what happens to blood pressure when doing a plank exercise or a wall sit. Lastly, the Valsalva maneuver should be avoided in people with high blood pressure because it can cause very large spikes in their blood pressure. The Valsalva maneuver is a weightlifting technique that's used to move heavier loads, and it involves holding your breath to help increase the stability of the abdominal region. Now, the Valsalva maneuver, it's arguably necessary for lifting heavier loads in some strength power sports like Olympic-style weightlifting or powerlifting, but it's best to be avoided if you have high blood pressure. Keeping these exercise tips in mind while you're planning your exercise program can help keep you safe while still enjoying the benefits that exercise has to offer.